Hi, everybody. Welcome back to another episode of Ask the Experts, where we talk to experts in the field of holistic wellness. Today, we have Dr. Alexis Michopoulos here with us. He's going to talk to us more about her specialty, which we'll get into here in just a second. But, Dr. Alexis, if you want to tell us a little bit more about you and your background.
Absolutely. Good morning. Thank you so much for having me. I am a board certified family practice physician. I've been in practice for a little over 10 years now. I'm a Colorado native. I'm born in Colorado Springs, went to school in Denver, did my residency in Pueblo, and now I'm back here in Denver again.
Awesome. That's great. So today we're talking more about PCOS. So I wanted to ask you, like, what is PCOS and what got you interested in helping people that struggle with that diagnosis?
Absolutely. So PCOS is polycystic ovarian syndrome or polycystic ovary syndrome. And it is something I think that people are hearing more about, which is fantastic because I was reading a couple of articles in preparation for this, and I looked at one back in, I think it was from 2016, and it said 7% of women suffer from PCOS. It's more like 20% of all women suffer from PCOS, and probably 50% of those are undiagnosed. So it is very prevalent, and it's something that hasn't been paid attention to in the way that it deserves. Initially, when the criteria was created, it's something called the Rotterdam criteria. It's 3 pieces of criteria, which is hirsutism, or male hair growth, so hair on the face, shoulders, back, chest, ovulatory dysregulation, whatever that means.
Mhm.
In essence, irregular ovulatory cycles, but you can still have a regular period and have ovulatory dysregulation. And then the third is cysts on the ovaries. Previously, it was you had to have all three, no, I'm sorry, 2 out of the 3 criteria to qualify for a diagnosis of PCOS. And what we have learned in the past several years, and something that I have made a huge effort on understanding, is what are the other things that we need to be looking at in order to diagnose it? And how I got started with all of this is I have always struggled with my weight my whole life. And I remember I was working out with a trainer ridiculously hard back in 2005, and we weren't seeing any results. And I ended up talking with an OBGYN in the town that I was in, because one of the docs that I worked with said, I think that you might have PCOS. And I talked with him, and I have the facial hair. And he said, well, it's because you're Greek. Okay, I can't lose weight. Well, you're probably eating more than you think you are. You really should write down a food journal. Everything that you put in your mouth, you need to write down. You're probably not working out enough. And I said, no, I'm working with a personal trainer, and I'm on an 800 to 1100 calorie diet a day. This is what I eat every single day. I work out 2 hours every day. And he said, well, your periods are regular, so it can't be PCOS. I'm like, well, then what's going on? And he's like, I think you probably just need to eat less and you need to work out more. And that's the story that's been told to me my whole life. And it makes you feel crazy,
Well, and that's
because
really harmful information to tell somebody. Yeah.
it absolutely is. And it didn't matter what I said, I mean, I could have had my trainer come talk to him and it still would have been me. And there's something I'm missing, and I need to do something more, and I'm screwing something up. And then so it's just something that I fought my whole life, and I just thought my fate was to be the chubby kid, and there's nothing I could do about it. And it's frustrating to work so hard and not make the progress that you see other people make and achieve so easily. And then several years ago, I suddenly put on, it was about 20 pounds in a month.
Mhm.
And while still working out, eating well. And I'm a physician now. And my partner said, you need to go to the doctor. And I go, why? I know what he's going to tell me. I know what I would tell me if I were a patient who came in. I know what he's going to say, and all my tests are going to be normal. So why? And he goes, I don't know, but this is the most depressed I've ever seen you. You have to go. So I went in and I actually ended up listening to a podcast by a specialist. Her name is Catherine Sharif, and the podcast is on the Curbsiders podcast, which is it's made for physicians and medical residents in training. And she's one of the leading specialists in PCOS, and she completely changed the way that I look at polycystic ovarian syndrome. And I'm listening to her talk about all these things, and I'm like, oh my God, this is me. And I go back and I look at the labs that my physician and I did, which were all normal according to the lab ranges. But when looking at the criteria and the ranges that you need to be using for a female and a female who has this type of endocrine disorder, my labs were so abnormal. I was off the charts, and it was one of the most freeing and frustrating moments of my life, because I realized, oh my God, this isn't my fault. What you're telling me is I've been working so hard, and if I hadn't, I would be so much worse than I am. So everything that I have been doing was for a purpose. My health would be so much worse if I hadn't worked this hard. But also, you're telling me if somebody would have listened to me when I was begging to be listened to, my life would have been so different. My health would have been different. My relationship with myself would have been different. So it was a very interesting moment inside my head when I found all of that out. But then I had the tools to really look at, I mean, how widespread this disorder is and how we need to be diagnosing it, and then how we need to be treating it. Because many people think that PCOS is essentially you're overweight and you have difficulty getting pregnant, but that's not true. PCOS is insulin resistance. Insulin resistance is, for all intents and purposes, pre-diabetes. You will end up with metabolic syndrome and diabetes if this goes untreated, and that puts you at risk for cardiovascular disease, stroke, heart attack, fatty liver, which is one of the top leading causes of liver transplants. This is a serious issue with a lot of serious consequences. It's not just, sorry, you're fat and you're going to have trouble having babies. It is so much bigger than that, so much bigger. And we're missing it. We're missing the diagnosis.
Yep, absolutely. And you hit the nail on the head that I think that a lot of women unfortunately struggle with this and just can't get the diagnosis. So it almost gets to the point where people really rely on kind of like preventative things for the symptoms that they're feeling. Which I feel like a lot of times if they are not symptomatic but may have an insulin issue, that it just kind of gets a little muddy. It's not clear. Or
You're
like,
absolutely right.
You don't necessarily need a diagnosis in order to like be healthy and treat your body the way that it should be. But if you have a diagnosis, it really helps kind of narrow down like what the preventative steps are, and then what like the treatment is after that. So I totally understand where you're coming from when you said it was like the most freeing, but also like terrifying part in your life when you got that diagnosis. Because I struggle with autoimmune, and that is exactly like how it felt after you finally know what's happening to you. So with all that being said, is it possible for women who have PCOS to not have symptoms?
Yes.
Okay. So, what would that look like? Would you be able to diagnose from a test, or like how does that work?
And that's the tricky part. You know, I think the other thing that I struggled with women's hormones in general, because once I really started to do a deep dive into this, I started getting everybody's PCOS patients. And once you see it, it's like when you're shopping for a car, right? You want to get a Jeep. Now all of a sudden you see Jeeps everywhere. Yes. Right. And I'm like, oh, she has PCOS and she has PCOS. And oh, everybody has PCOS. Yeah, exactly. Right. And she drives the Jeep. And so, you know, and it was again, a very great and exciting thing, but also I was like, oh my God, I've missed this so much. And how many women have I told, you need to eat better? You're probably consuming more calories than you think. And then these PCOS patients start to go through menopause as well. So you have, and it's difficult because I've been that physician who, I don't want to say wrote people off, but when you don't know what you don't know, what can you do? And when that's what you're taught and what you're trained is PCOS patients are overweight and they have a hard time getting pregnant, and women who are going through menopause, it's just normal and they need to suck it up and stick it out. When that's what you're taught, that's what you know. So I don't want to speak disparagingly of the medical community because it took a lot of extra time and training on my part as a doctor individually to learn and understand this. And what I have found is there is a whole slew of lab tests that can be abnormal when you don't have overt symptoms. And if you don't have a physician who understands, or a healthcare provider who understands what tests to order, but then also how to interpret them, like I don't go by the lab values. And I still have people whose labs can be relatively normal because when you are compensating with aggressive diet and exercise, you can keep your labs relatively in check. But the things that I find symptomatic wise is, again, so there's the facial hair. I don't care if you are Greek, Italian, Egyptian, Hispanic, Jewish. No woman should ever have dark, wiry hair. I'm not talking peach fuzz. I'm talking that everybody knows I'm talking about that dark hair on your face anywhere. You should not have dark hair anywhere midline, including below the belly button. If you have that, and we tell women that that's normal. If you have that, that is hyperandrogenism. That's PCOS. If you have acne on the corners of the jawline, the chest, the shoulders, the back, on your butt, that is most likely PCOS. There's a condition called hidradenitis suppurativa, which is you get these very deep infected cysts in certain areas of the body, which are in the highly concentrated areas of androgen receptors. Hidradenitis suppurativa, PCOS until proven otherwise. Any woman who's been on Accutane, PCOS. All of these things that we don't talk about. Another thing, I mean, I will have women who are thin, who have regular cycles, and have had no idea that they've had PCOS their whole life. And they're coming to me just for like the basic, let's check everything. And their blood sugar will be a little bit high. Again, not out of range on the labs, but an elevated fasting blood sugar. And at that point, I'm like, wait a minute, even though they're thin, they always have this, I call it a built-in flotation device, that little pooch. Belly fat pooch, right? That's insulin resistance. And I asked them, have you ever been able to get rid of that? No, anything that I've ever done, like that's always been there. The rest of my body, will be thin and toned, but I can't get rid of that. That's insulin resistance, and insulin resistance and PCOS go hand in hand. And then of course there's the bigger stuff, sudden weight gain, extreme difficulty losing weight, and then the irregular cycles for sure. That's those are the obvious things. But I think with the screening test that I have started to do, I have found it in women before it's even started to flare up, and we've been able to get a handle on it. It's triggered a lot by stress, big stress events, good and bad stress. But that can definitely, if you're one of those people who's on the fence, it can tip you over, and the PCOS will show itself.
Totally. And I think a lot of times it is like something that triggers a diagnosis like this to happen, or your body to actually start screaming for help when you've kept it at bay for so long. Because like you're saying, insulin resistance, that's built up over time. That's not just like all of a sudden you're insulin resistant. But yeah, our bodies are meant to handle stress, but not acute stress, is what I like to say. It's like we can't be in a fight or flight mode all the time, or else our body's going to be screaming for help in other ways besides just showing you that you're stressed.
Yes.
Yeah, very interesting. So So I have kind of a twofold question.
Okay.
First one is if somebody comes in and they're not showing the normal signs of
Mhm.
PCOS, but you see it in them that they most likely have PCOS, what's the treatment at that point?
Well, I mean, obviously it's very important to me to educate my patient and explain to them what's going on and why, and what does PCOS mean? Because some women are like, well, I don't want to get pregnant, so it doesn't matter. No,
Mhm.
it does matter. And this will impact not only your quality, but your quantity of life. This will shorten your lifespan eventually
Mhm.
if it's not treated. And so making sure that they have all of the information they need to make the best decision for themselves is a huge priority. If you aren't getting that from your provider, ask for it. If they won't give it to you or they can't explain it to you, go find somebody else.
Mhm.
With that being said, then we have to talk about where they're at, what they're willing to do. You know, some people don't want prescription medication. Other people are like, I'm done with this. I give it to me all. I don't
Mhm.
care what happens, what the side effects are. Like I need to get this under control and I need to see some change or I'm going to lose my mind. So looking at things that help with the underlying problem is the insulin, and we don't really know what comes first, the chicken or the egg, as far as like the inherent um ovulatory issue, or is it the insulin that causes the ovulatory issue? We're not sure. It doesn't really matter. It's all treated the same way, but we have to give you something that will help you better utilize the insulin that you have and also bring the insulin level down. Insulin is a building hormone, which is why you can eat 800 calories a day and you will gain weight. It's because when your insulin levels are so high, the insulin takes it and it will store it as fat. And
Mhm.
it doesn't do its job correctly in other ways as well. So everybody hears about metformin. Um, I personally think that that is a fantastic medication. It helps with the sensitization to the insulin. It helps your liver stop making extra blood sugar that you don't need. Um, it's cardioprotective, and it also has it's questionable, but it's up in the air. It's being studied as far as longevity properties. Now, people who don't want metformin, they can use a supplement called berberine,
Mhm.
which works in the same mechanism as metformin. The other thing is, which I should also remind people, that supplements are medicine too. They have side effects. They're all made in a lab. There's no such thing as natural. I wish that there was, but is it a different modality to use? Absolutely. And does it work better sometimes for people than prescriptions? 100%. I actually have been using the GLP-1 medications that we all hear about now, Ozempic, Wegovy. I've been using those for years to help with PCOS because it really helps that insulin resistance. The other thing we have to look at is diet.
Mhm.
And for somebody who is insulin resistant, you need to be on a ketogenic diet. This is not for everybody at all. And I don't think that keto is the answer to everything. But when you are insulin resistant, a calorie is not a calorie, is not a calorie, is not a calorie. And that's really hard to retrain people because that's not what we've been taught growing
Yep.
up at
We
all.
still aren't taught that. Yeah.
Exactly.
Commercials that are on TV. Yeah, it's
And it's
everywhere.
confusing. It's so confusing to figure out what's the right information, what's the right information for me. So talking with somebody who really understands these things is so important for these women who are struggling with this. But keeping a strict ketogenic diet will help bring that insulin level down, and that's what has to happen in order for things to start to change. So there's absolutely prescription medications, and I have some patients who don't want anything to do with those. I have other patients where I'm like, this is what you need. We have to do these right now. Let's get some of this weight off of you. Let's get these numbers down. Let's get your cholesterol down. And then let's talk about coming off of it. And I have a few patients who've been able to get their PCOS under control and keep it under control without medication, and just lifestyle changes. Other than that, most people usually have to stay on some type of medication, whether it's indefinitely or intermittently when the PCOS starts to flare up. And that's okay. This is the same thing as if your thyroid were to burn out. And I say, I have to give you thyroid replacement hormone. You can't think yourself out of it, exercise yourself out of it, meditate yourself out of it. All of those things are also very helpful to that. I mean, we have to treat all of you if we're going to treat all of you, right? One part of you just can't get better. But PCOS is very challenging to work with. And if you end up having to be on medicine for it for the rest of your life, that's okay. There's nothing wrong with that. And again, we're looking at the big picture, the end picture. We want to decrease your risk of having a heart attack. Cardiovascular disease is the #1 killer of women. We don't talk about that either. We have to decrease your risk and keep you safe.
Okay. And so with PCOS, if somebody wants to take the medication or has to take the medication, and you're saying it could be intermittently, it could be for life, you just don't know. Everybody's bodies are so different, which I totally respect and understand.
Yes.
How frequently are you seeing these patients for retesting to see where people's levels are, all of that?
No, that's a great question. It depends on how severe the insulin resistance is. And if, for example, their cholesterol is still under control, it hasn't bled over into that aspect of health yet. I can see those people a little less frequently. I test insulin levels. It's much more accurate than fasting blood sugar, and it's much more accurate than hemoglobin A1C, which is one of the modalities that we can use to diagnose diabetes. I use fasting insulin levels, and they, in theory, should be less than 5. So I have women who theirs is 40, and we start them on a regimen, whatever that looks like, with or without medication, but diet and lifestyle change. And when you begin to lose weight, because you will, I know that your insulin number is going down.
Yeah.
And women want to have that rechecked. And that's another thing I think that I learned through all of this. If somebody's requesting something and they need a test, or they want to see that number, they need to have that objective data, because our minds mess with us so much. We can drop 4 dress sizes and we're still like, did I really lose the weight though? And it's going to come back like tomorrow if I go have brunch, right? It's all going to come back. Like, I'll order it. We can monitor your insulin levels for sure. We also have to keep a very close eye on your the cholesterol levels. The other thing is, hormone wise, again, we can monitor the levels, but it's more like what's happening with your body. Is that facial hair and acne getting better? If it is, we know that we're doing the right thing. And that's the other thing. You need to make sure that you find a provider who's going to look at the whole picture. I'm not going to just look at your labs or just look at you clinically and make a decision. I have to look at all of it. And if your labs are pristine, but you are still having that acne in those areas that we were talking about, or your weight loss has now plateaued, I'm not going to say, well, your labs got better, so you must be better. No, there's still something that we need to work on. So it's a combination, and it's making sure that you yourself are paying very close attention to your body and what's going on with it, and that you're communicating it with your provider. And that's something that I have to work really hard with my patients on, is I tell them all the time, you are not crazy. What you feel, want, and need is real, and you have to tell me what's going on. So if your labs are getting better, but you aren't, you got to let me know. And that's also something I am monitoring. There's not a great lab test for any of this, because just like you said, everybody is an individual, and everybody presents differently, and everybody responds differently to treatment. So there's basics that we use to diagnose it and that we can to follow it. But again, just because your labs improve, if you aren't improving, then we have more work to do. And there's another piece that we have to figure out.
Right. Okay. Interesting. Awesome. Well, is there anything else that we didn't touch on that you feel is important for people to hear about in relation to PCOS?
I think It's reminding women that you know your body better than anybody else. I have so many people who come to me and they're like, well, I saw this thing on TikTok, so don't be mad at me. And I'm like, at this point, it's information, right?
Yeah.
It might be right, it might be wrong. Let's
Right.
talk about it. And if it's something that rings true to you and you feel applies to you and your body, bring it up. Let's talk about it. It may not be what you have going on, but it might make me think of something else that I wouldn't have necessarily thought of.
Yep.
So listen to yourself. We've trained women to tell themselves that they're crazy. We've trained women to tell themselves just wait longer.
Yep.
It'll see if it goes away on its own. If something's different, it's different. And you are going to know it before anybody else. And you need to be able to have that open, honest dialogue with whoever it is that you're working with. And again, like I said, if you don't feel like you're being heard, you need to advocate for yourself and say, hey, I know you're in a rush, but could we talk a little bit more on this? I'm not sure if you really understood what it was that I was saying or where I'm coming from or what my concerns are. And once you tell them that, if they don't respond appropriately, then you need to go find somebody else who's going to listen. Also, there's nothing wrong with asking your providers why.
Mm-hmm.
If they say we don't need to treat this, why not? Or
Mm-hmm.
we do need to treat this, why?
Mm-hmm.
And if they cannot give you that information, you need to find somebody else who can. And it's important, especially with PCOS, to work with somebody who's focused on it, who knows about it, who understands it, and who's going to advocate for you and not blow you off and not tell you that you're
Yep.
crazy.
Yeah, I
It's
think,
real.
yep, advocating is a huge thing. I think, yeah, a lot of times, like you said, women are told we're crazy, or we ourselves are like, it's fine, everything's going to be fine. And we just like continue working to do the best we can every single day. And it's just so important that you have a medical provider team behind you who will help you out with those questions that you have, because not all of us are doctors, not all of us have a background in this, but we all deserve to be feeling our best every single day. And that's not something we have to earn. That's something that just should be the normal for every single person. So,
You nailed it. It is not something that you should have to earn or prove.
mm-hmm.
And keep in mind there, this, again, I think the other thing is teaching. I teach residents, other physicians in training, and I teach other physicians about this because we have to change the way that we're approaching PCOS, and we have to change the way that women see it and understand it. This is a serious, serious syndrome that needs attention, or it's going to result in very serious consequences. And again, it's about really looking at the whole health of the person. And it's not just these perceived frivolous things of difficulty with fertility and you're overweight. I mean, that's so detrimental to so many people. That being said, it's so much more than just those two things that we as physicians have been told to focus on and patients have been told to focus on.
Yep. Yep, absolutely. And it's a big puzzle. When you're working with every single person, you're not treating every person the same when it comes to the same diagnosis. And I think that's another big thing for people to understand, is that you have your own biochemical needs and individualities, and the treatment is not the same. It's not a blanket statement. So, yep,
Correct.
I totally agree with that and respect completely what you're doing. I'm happy that you said that as an ending for this recording. Thank you so much. So, for people who are listening who may have an idea that they might have PCOS, or they do have it, where can people find you to work with you?
Absolutely. I'm located in the Denver area, but I do virtual appointments as well. I have my website, which is Dr. Alexis M as in Mary.com, and it's the word doctor spelled out. All my contact information is on there. My office number is listed. And then there's a way that you can send me a message straight on my website. Doesn't matter. It can be in the middle of the night while you're scrolling through things. You try to figure out what's going on.
Yeah.
send me a message. I have the option. I'm more than happy to have a 20-minute phone call with people to let them know what my thoughts are. And obviously I can't give medical advice, but to give some support and reinforcement and say, yes, I do think that this is something that is going on with you, and absolutely you should do something about it, and no, this is not your fault.
Mm-hmm. Yep. Totally. Instead of doom scrolling for the rest of the evening.
Correct. Doom scrolling. Yes.
To Alexis.
Yes, please do not doom scroll.
Yes, that is what it's like. Middle of the night, you start thinking and spiraling, and yes, looking everything up on Dr. Google, and that's not the best place to be. So, awesome. Well, it was so great talking to you today, Alexis. Thank you so much for sharing your knowledge and information about PCOS, which is such a growing concern for a lot of women. We really appreciate it, and we will talk to you next time.
Thank you so much. Have a great day.
All right, we'll talk to you soon. Bye.
Thanks.